Some people got to have it. Some people really need it. Listen to me, y'all. Do things, bad things, Willie. Well, you wanna need me scream almighty die. Got one there.
When you've been as successful in business as I have been, you know controlling cost of healthcare is absolutely critical. In this room today, we've got Team 1 here, Andy Halpert, Juan Davila, some of our smartest people at Blue Shield. Team 2 over here are some people with some bright ideas, they think. So here's what you're going to do. You're going to go back and work with your respective teams to come up with a plan to reduce cost of healthcare at Blue Shield. Number 1, I want you to reduce the unit cost to meet Blue Cross of California. Number 2, get the utilization statistics in line with industry benchmarks. Number 3, find a way to get to a balanced risk pool. Number 4, control our administrative costs to get within the median of the other health plans in our industry. You'll be judged by these 2 executives here, Alan and Heidi. Now get out of here and get on with lowering cost of healthcare. Your cost of healthcare really drives your competitiveness. If you're 10% better on administrative cost, it helps, but it doesn't have anywhere near the impact you would have if you were 10% better on cost of healthcare.
This is really all about being competitive, and what we do here really will make a difference.
We have to remember how the economics of health insurance work. So for every 100 cents on the dollar that we receive from our purchasers and consumers, 85 cents of that is paid out in cost of healthcare.
Okay, so bottom line here is we want to save some money.
Right.
What do you think?
I've got it. Coin-operated computer.
I like it. I like it.
This whole thing is ridiculous.
What do you think? What some ideas you have?
Well, I think we should go to the hospitals that are the most expensive and try to
What if we
negotiate
put a
contracts.
swarm of bees around the office supplies? No one would want to go over and get any.
Theirs would work
This
even
is
better.
a colossal waste of time. This whole conversation.
I like it. I think it's great.
I do too.
You know, I think you guys have this under control. We're just going to be leaving now. Right.
All right.
Cost of healthcare is so important to Blue Shield because the cost of healthcare is the majority of the premium that the member and the employer pay.
The way we're going to win this thing is actually, we've been thinking about cranking out a new way of doing business internally.
In terms of utilization, our goal is to make sure our members are at the right place at the right time at the most effective cost.
We do have goals, as we did last year in the cost of healthcare group and with the regional strategy.
Okay, so both teams were tasked with finding out how to get Blue Shield's costs at or below its major competitors. Alan, how did Team 1 do?
Let me tell you a little bit about what they did. For starters, they gelled really well as a team. They redesigned the regional strategy, they worked on utilization management, and they have a clear understanding of the 2008 objectives and a plan to make it happen.
Team 1 sounds like they know what they're doing. Heidi, how did Team 2 do?
Well, David, the phrase that comes to mind for Team 2 is hideous down spiral of incompetence. And I'm really not sure that's strong enough.
Boy, you guys really blew it. You saw what Team 1 came up with. What did you come up with?
The Schwarzenegger 5000, a personalized robotic trainer that we can sell to all of our customers.
David, you have arms like a little girl.
I think I've heard enough. You're fired.
The David is really serious about the cost of healthcare. And if you don't deliver on your cost of healthcare project, you're fired.